Hi, everyone. This is Mohamad Bittar. I'm a rheumatologist at the University of Tennessee Health Science Center in Memphis, Tennessee. I will be chatting today with Dr. Gladman, Dr. Dafna Gladman, who is a senior GRAPPA member. Dr. Gladman is a professor of medicine at the University of Toronto and senior scientist at the Krembil Research Institute. She is deputy director of the Center for Prognosis Studies in the Rheumatic Diseases, co-director of Lupus Clinic, and director of the Psoriatic Arthritis Program at the Toronto Western Hospital. Dr. Gladman's research activities span both clinical and translational research. Dr. Gladman has carried out studies looking at early identification of psoriatic arthritis and predictors for outcome and quality of life and function. In her laboratory program, she has performed studies looking at susceptibility genes and biomarkers for disease expression. Hi, Dr. Gladman. We are happy to have you with us today.
Pleasure to be here.
Thank you. I would like to start by asking you about your experience with GRAPPA. Could you tell us about your initial role and journey with GRAPPA?
I'd like to think that I played an important role in the development of GRAPPA. So the story is quite interesting, actually. In the early 2000s, there was an attempt by a number of Italian rheumatologists to develop criteria for psoriatic arthritis. And they asked me to help them out. And so I contacted the president of EULAR to see if they would be interested. And he said that Dr. Philip Helliwell already had a program that he had applied for. So I called Philip Helliwell and I said, look, I don't know how extensive your program is, but here are a bunch of Italians who are interested, and I'm interested, and I know that there are a few people in the United States that are interested. So why don't we just join forces? And Philip thought it was a great idea. And so the group grew, and some of these Italian rheumatologists participated, and we got Philip Meese and Christopher Richlin and a few other people in the States involved. And that was the CASPAR, the development of the CASPAR criteria. At the same time, Philip Meese had attended the ASAS meeting or the Ghent meeting, and he realized that ASAS was had been organized in a certain way. And so we had met, Philip and I, through the National Psoriasis Foundation in 2000 after he published his study on etanercept in psoriatic arthritis. And so he and I got together and decided that why don't we stop at the CASPAR? Why don't we develop a group? And so we decided to bring a whole bunch of people together. And in 2003, we had our first meeting in New York. And it was, you may or may not remember, but there was a huge power outage through the eastern seaboard of the United States. And so it started out shambles because there was no light and people started to come in. I couldn't even get in because there were no flights out of Toronto because everything was closed. And anyways, the person who was running GRAPPA at the time, or at least that was helping us set up the whole thing, Robin Shapiro, she walked out Manhattan until she saw lights. And she went to the first hotel that was lit up, and it was the Westbury, I think. And she asked them if they could accommodate her meeting. And they did. And so she moved everybody from the Marriott to the Westbury. And then she called me and asked me if I was going to come. And I said, you find me a flight, I'll come. So she found me a flight. She arranged to pick me up at the airport, and it was fantastic. Now, Philip and I had met a few times at the ACR and actually made plans for this meeting. So we knew exactly how this was going. And for the first 3 years, Philip and I were just running it. We would organize the meetings. We would make the plans for the meeting, and of course involved other people, but we set up the agenda and everything. And then in 2006, it became more formal when Philip Halliwell wrote out sort of a guideline. There's a word for it, I can't remember, but there's a constitution. And so I became the first president, elected as first president. And so I was president for 3 years, and then different people. And now we set it up right from the beginning as a collaborative group that composed of both rheumatologists and dermatologists and anybody else who was interested in the study of psoriasis and psoriatic arthritis. So there were some methodologists, some radiologists, and we also incorporated members of the patient groups. So various patient groups like the National Psoriasis Foundation in the States, and then various groups from Europe participated in GRAPPA. And in addition, we also allowed drug company representatives. Philip was a whiz at getting financial support. So we got a number of industrial partners, and they were allowed to send medical people, not marketing people, but medical people to the meetings. And it was set up in a very similar way to the way OMERACT was run, because the way we set it up initially was to identify outcome measures for psoriatic arthritis. And that was kind of our focus for the first couple of years. Once we got together, we set up agendas for development of treatment recommendations and other aspects of the program. But our first focus was on identifying proper outcome measures for psoriatic arthritis. So that was done in an OMERACT style, where we presented the data that was available, and then we had breakout groups, and when we had agreement on certain items, and eventually presented what we had decided to the OMERACT, the following OMERACT session, to be accepted as an internationally endorsed set of criteria. And then subsequently, we did the treatment guidelines, or treatment recommendations, we call them. So it's been an amazing trip.
It sounds like it. Thank you so much for sharing with us your experience and journey with GRAPPA as one of the co-founders. I'm pretty sure a lot of the young members will learn a lot from your experience. It's fascinating how collaboration between different experts can lead to the starting of big organizations such as GRAPPA.